Hi, I'm Sherry, registered nurse and quality care manager at Associated Physicians.
My name is Monique. I'm the medical assistant supervisor at Associated Physicians.
I'm Dr. Katie Cahill, and I'm a pediatrician at Associated Physicians.
I'm Courtney. I'm a pediatric nurse at Associated Physicians.
I'm Dr. Laura Berghan, an obstetrician gynecologist at Associated Physicians.
My name is Lisa, and I am the registration supervisor at Associated Physicians.
You ready?
Okay.
Go ahead.
Healthcare workers are in the middle of a disaster situation, canceling surgeries, triaging, and rationing care, struggling to find beds for our critically ill. This is not what we want, not what we want for you or your family. But even so, healthcare workers are still here for you.
Even with all of the precautions and strict COVID policies, we had to face the fact that we can't worry about if we get COVID. We have to worry about when we get COVID, and that's really scary because we have lives and loved ones outside of our jobs. COVID has not only left us short staffed, but it's also really ramped up the number of patients that we're seeing regularly. We're just constantly overwhelmed, and we've got staff who've even jumped into roles that they normally don't do, just so that we can ensure that we're providing the same level of care that we normally do to our patients.
We're tired of the misinformation. It's just not about picking sides. It's about human life and doing what you need to do in order to protect the vulnerable individuals in our community. Hospitals are full of unvaccinated patients. This is not propaganda. It's not part of an agenda. It's just the truth.
We're balancing all of this fear and worry and the stress that the constant changes bring. But even with the low morale, we still fight to put on a smile. It's what our patients deserve. What hurts the most is taking a phone call and learning that another patient has died from COVID, or that a really young patient is dealing with severe anxiety and depression, and then having the next call be just yelling and swearing over something that we can easily help with. We know you're frustrated. We know you're tired. We are too. Right now, that little extra bit of compassion is what is getting us through the day.
So I came to Associated Physicians about 40 years ago because I wanted to develop and create long-term relationships with our patients. I've been able to do that here. It's a special clinic, it's a small clinic, it's independent, so those close relationships were not difficult to build. We become a part of our patient's family. They share their stories with us. Sad stories, happy stories, births of their children. They send us thank you cards for just being in their lives. I have stacks of thank you cards. They send me photos. I have a collection of them that I can't part with that is on the wall behind me. Picture of a patient when she turned 105 and a half, and she gets to count that half. One patient sent a photo, the best part of waking up, and he's holding a tray of desserts. These patients make me smile. They will always make me smile. I will laugh with them and I will cry with them. It's a constant emotional battle with COVID. So I need just a minute. So when we lose our patients to this virus, we carry that weight too.
We used to be called heroes, even when we knew our efforts weren't enough to always protect our patients. Now, our training, our expertise, and even our intentions are being called into questions. I don't want to be a hero. I just don't want people to die unnecessarily.
What hurts the most is it doesn't have to be this way.
You can save more lives than we can. You can be the hero.
Please get vaccinated and boosted as soon as you can.
Wear your mask correctly, social distance, avoid crowds.
Get tested, know when to isolate and quarantine, and know what the difference is.
Be kind. Be patient. And please be understanding.
We need your help.
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 I gotta start over. I'm sorry.
Yeah, we can. I know that was hard.